wanted to share with you a removable case that came through the laboratory recently. It's interesting because it's a class 3, and so you can see here we have the bite block. Let me take it off for just a minute and we'll look at the impression this dentist took. He did a pretty good job. You can see all the details are there. In fact, let me just jog your memory back a little bit to dental school with this model, where we take a look at some of the desirable anatomical structures that we want to pick up here. The tuberosity, the hamular notch, the vibrating line, the incisive papilla and the rugae, the labial frenum, all these highly desirable anatomic structures that we want to see. And really, this is only possible with the use of a custom tray. And sometimes we'll see dentists send in impressions to us like these two upper arches that you see here, and we're missing a lot of that material. And these were not preliminary impressions to make custom trays from. These were supposed to be final impressions. And so typically we will make custom trays and say and tell the doctor that we need a master impression from a custom tray. And so the custom tray becomes really important in these denture cases for picking up things like on this lower arch with the retromolar pad. And we've got the retromylohyoid space down here, all this stuff that needs to be picked up and really can only be accurately picked up with a custom tray. But in the case in particular that we're talking about here, the doctor did a very good job. And so as we take a look with the bite block in place, we always send it out with the front two teeth to help you get the midline and the fullness of the lip as well. And as the patient bites together there, I think you can tell from that position that this is a class 3 case. That's what the patient naturally was. So the doctor did a good job and use some of our clear bite material to get a nice bite registration. And it's an accurate class 3 bite registration. So we went ahead and we proceeded with the case and sent it to the dentist. And we've got this class 3 setup that you see here, which is basically what the patient had ahead of time. And now when the patient had an opportunity to try this in and look at it, she was unhappy, and she didn't, I think, realize what the implications of being a class 3 were going to look like. In fact, she said later that part of the reason she was glad she was losing her last few teeth was that she could have a normal bite and not have this class 3. So now it was up to us at the laboratory to try to figure out how to set this up as a class 1. And there's really two ways that we can do this. If you've got a patient who's a class 3 who wants to become a class 1. And the first one is to go just straight class 1 as you see here. So this is a regular class 1 with 20-degree teeth on the back. And the thing that changes here, obviously on that class 3 setup, the teeth are sitting right over the ridge, which is where those teeth really should be. But for an aesthetic change like this, we're going to move the maxillary anterior teeth out to the facial from where they were on that other class 3 setup. So the mandibular teeth are going to stay positioned over the ridge because we don't have a lot of stability with that lower denture, but we're going to try to take advantage of the palatal seal back here by moving the maxillary anterior teeth towards the labial, and that's how we're going to achieve this class 1. This is also going to plump up this lip a lot, which is a request that we get a lot with female patients to get rid of wrinkles. This might plump it up too much, or it might be just enough. You won't know till you see it in the patient's mouth. Really, the only downside of doing this, besides putting a little more stress on the palatal seal, is that we have to open up the bite to be able to do this. Now, some patients cannot tolerate having their bite opened a couple millimeters, and so one of the things we can do in a case like that is to go to a different type of class 1, where it's a class 1 setup still from the anterior, but it's more of an end-to-end relationship when we look at the posterior. And in a situation like this, to give the patient some freedom, we'll typically set this up in a 0-degree or flat tooth to give the patient some freedom to be able to move around. And this is where we ended up with on this patient who didn't want to look like a class 3, didn't like the feeling of being opened a couple millimeters to become a true class 1, but to become kind of an end-to-end relationship but still look like a class 1 with the 0-degree teeth is where we ended up with this patient. So when you've got a class 3 setup or a skeletal class 3 patient coming in for full dentures, know that you have a couple of options, and our removable technicians will be happy to help you with that.